My name is Tim Reha, host of Digital Health Live here at UCSF for the 2015 Digital Health Summer Summit. We got a friend, partner who helps us out with some events, Dr. Stephen Chan, came down and was part of the media team as well as kind of working behind the scenes with all the speakers. How are you doing?
Doing great, Tim. How are you doing?
Good, good. So give everybody a quick rundown of your background, and then we'll go into the future of digital mental health.
Right. So I actually did software engineering back at Microsoft, and we worked on voice user interfaces. Cool. And then I went to medical school, UC Irvine, went to business school, and now I'm at the University of California, Davis, where I'm working on a psychiatry residency, but also telemedicine research, and I'm helping out a lot of great people over there.
So tell me the future of digital mental health. What is that?
So a lot of times when we think about digital mental health, when we think about mental health, we think, well, just a face-to-face interview with a doctor and a patient or a therapist and a patient. But it's not scalable. We need to actually have more support for that sort of interaction. So what we're looking at, especially at the University of California, Davis, also UCSF is doing a lot of work in this area, is can we use smartphone apps to help out with mental health, and can we also use telemedicine so that you don't have to be there, not just at the same place, but also at the same time. So Peter Yellowlees and Don Hilty at the University of Southern California, a lot of other researchers, great minds are working on this, and I'm also assisting with the research as well.
Okay. What's the research?
So Peter Yellowlees created this idea that why can't we just record a video of a patient and a nurse or a therapist speaking, and then capture that video, send it to a specialist so that they can evaluate. So that's something we call asynchronous telepsychiatry. We already have a clinical trial underway right now at UC Davis, where we're getting about 200 patients, and so we're gathering data. We're going to be talking at Stanford Medicine X later this fall as well.
Yeah.
So. Yeah,
that's coming up.
That's coming up. We're going to be talking about that, and also we're going to be talking with the National Director of PTSD, as well as the Chair of Communications at the American Psychiatric Association at Stanford Medicine X, more on the future of digital mental health.
That sounds really fun. So what was your highlight today?
So today was very interesting because we had all sorts of people, physicians, payers. We also had a lot of venture capitalists come in and talk about what they think is in the future. But the highlight for me was the transformative partnership for UCSF. They're working, they had some folks from Ginger.io and Big Health, and I also spotted some other folks in the audience who are working on digital mental health technology. So this is going to be very big this year.
Very cool. So how do people connect up with you?
So if they want to connect with me, they can go to my website, stephenchanmd.com or digitalmentalhealth.com. They can also find me on Twitter as well.
Great work, and thanks again for being an integral part of our team and for volunteering once again here at the Digital Health Summit, Steve.
Thank you for having me, Tim.